and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, we just did a video on an ankle sprain, and basically when you just first have one, what should you do? Is it broke? How to wrap it? Now, after a few days, you're going to want to start some rehab.
Sure.
And that's what we're going to cover today in this video, ankle sprain rehab. Basically, the 7 things you really make sure you want to include when you're doing it.
Okay, so we're going to start like right after it gets
No,
sprained?
I'm going to give you some guidelines here.
Okay.
Basically, when you sprain your ankle, we're talking about generally the typical sprain where you turn your ankle in like this.
Right, inversion sprain?
Yeah, and generally you're spraining one of these three ligaments. Generally the anterior talofibular ligament right here. Mm-hmm. We've got the calcaneofibular ligament and the posterior tibiofibular ligament. Did I say it right?
That's a mouthful, Bob.
Posterior talofibular ligament.
The one that's on the back
The one
side.
that's on the back side,
Right,
yeah.
okay.
So this one's the culprit quite often.
Right.
But how bad you tore them, that'll depend on how long you wait.
Sure.
So a mild, if there's really no tear, you just strained it.
Right.
And there's really minimal swelling, and
They'll be pretty painful, particularly when it happens.
they can be, yeah. Strains tend to hurt more than tears.
Sure.
I mean, complete tears.
Yeah.
If it's that, then you're only going to wait 2 to 4 days before you start rehab.
Sure.
If you have a grade 2, which is a partial tear, and a little more swelling, a little more discomfort maybe, you're gonna wait 3 to 5 days.
Sure.
If you have a complete tear, you're gonna wait 4 to 8 days.
Right.
And that's gonna be a lot of bruising, swelling.
Yeah, you're going to know it. It's clearly more involved.
So those first few days, what you're gonna do is you're gonna ice, you're gonna elevate, you're gonna wrap it, you're gonna maybe have a brace like this, right, Brad?
Right. These are really nice braces for ankle sprains that just happened. They put some compression on it. They stabilize it. People feel good with these braces on, in my experience.
Yeah, that's an air cast brace. There's different brands too. If you just put air cast ankle brace and Google it, they'll give you a whole bunch of choices. Yeah. And they got a little air bladder, which helps make it comfortable, and you can actually blow that up a little bit.
Change the support in it. These are ones you're typically sprained that you can walk in yet. It may be a little uncomfortable, but it gives you that support so you don't roll it in and it just stabilizes it.
If you have a grade 3 sprain, or even sometimes a grade 2, and you're really unstable, sometimes they might even put you in a boot.
Sure.
I mean, and you might need to use crutches during these periods of time that I was just talking about.
Right, exactly. Keep the weight off of it. Be nice to it.
All right, so now after you've waited the period of time that we suggested, now you're going to go ahead and what I think one of the things that a lot of people don't do is cross-fiber friction massage. So what you're going to do is you're going to find the tendon that's the culprit.
Right.
And you're going to go ahead and rub across it. So here you see this tendon is angulated like this. I'm going to rub across like this.
Right.
And start off very gently on these.
Yeah. If you start doing this and it gets sharp pain, it's too early.
Right.
You don't want to do it then.
Yeah, exactly. And as you start doing this, it should start to actually, after maybe 30 seconds to a minute, start to numb up and start to feel even a little bit better.
Right. Then you know you're on the right track.
Yeah, if not, then you want to maybe back off another day, put ice on it again for another day. You can try that ligament, and again, tends to be the culprit one, the anterior talofibular ligament. But otherwise, this one's not quite often as involved too, the calcaneofibular ligament. So it's the same thing. I'm going to cross it. Now you can do that for a good 2 to 3 minutes.
Sure.
Good cross.
As long as you get good response, your fingers will wear out before, because it'll feel good on your ankle at that point.
Yeah, and it's going to heal quicker. It's just going to get more blood flow to it. It's breaking up the scar tissue. It's just going to do a lot better. Let's start off with just getting some range of motion, Brad.
Sure.
And I think the easiest one to do, Brad, is just to draw the alphabet with your feet,
right?
With your toes.
Can I have that, Bob?
Sure.
Cool. What are you talking about, Bob? Alphabet with your toes.
I'm making an A, B, C.
I don't know. I couldn't read those letters. But yeah, I always tell my patients, pretend your big toe is a piece of chalk.
Oh, good.
And there's a chalkboard there, and imagine yourself drawing the letters on the board. And then when you get tired, you stop. And if you get to D and you're tired, and then 3 days later you can get all the way to P, well, you're getting stronger.
You're getting better,
and
right.
you get more range of motion.
I want you to do at least one stretch, and that's stretching the calf stretch. Do you want to give me a belt, Brad?
You bet, Bob.
Brad, you knew what I was thinking before I even
Well,
thought.
of course, Bob. We're in tune with each other.
Did we get the new subscribers yet? Did we talk to them yet?
Well, I don't think so. They're wondering.
By the way, for those of you who are new to our channel, please take a second to subscribe to us. We have a subscribe button there over by Brad. We provide videos on stay healthy, fit, pain-free, and we upload every day.
Very, very good.
So-
So we're going to stretch it, huh?
You're just going to put it around the belt around the forefoot,
Right.
and you're going to go ahead and pull towards you and give it a good stretch.
Now, be reasonable.
Yeah.
If you got some sharp pain, you're pulling too hard.
Yeah.
Another thing that you can, if you've got a cane like this at home, or your grandpa does, or you want to buy one, you don't need to do that. But this works good. Just to give it a little stretch like this as well.
Yeah, very
just an option.
very
Bob.
creative, Brad.
Thought I'd throw that in there.
Yeah, very creative. All right, and then we're going to start off with some strengthening, Brad, where you just want to start off with isometric first, where you can put the foot up like this, and you can push out that way. You can push in, you can push down, and you can push up.
Right. So if you look at it from this side, I'm
yeah,
trying
that
to
angle
move,
might be
move
better.
the foot this way, but I'm going to hold it, and I'm just going to push. My foot's trying to go that way, but I'm going to
Count
hold
to
it.
10.
1001, 1002. You don't have to count out loud. And then go this direction. And then
You
like
can do
Bob
it-
was saying, pull up this way, and you're going to push down.
And push down that
Right.
way.
To be honest with you, Bob,
A lot of times I don't do that.
I don't do isometrics. I go right to the therapy.
Right. If you have a really weak ankle or really bothering you, you could start with that.
Yeah.
But Brad's completely right. I haven't had it. I don't remember the last time I had anybody do that.
Right.
So-
I go to here. We'll get the right angle here.
This is where it really does pay off to have some stretch band.
Yep.
So
And this actually works a lot better if you have a pair of shoes on because it grips and you can control it. Now I'm going to work the outward. This is the most important direction.
right.
And it might be a little painful when you start. So if if it's too painful, it's too early. Just wait and give it some more time. Give it a few more days. And again, I'm going to do 10 to 15 repetitions this way. And now to go the other direction, you won't be able to see here. So I'm going to do it on this foot, but I'm going to move the foot inwards towards the other foot, and I'm going to give it some resistance here. And again, if I had my shoe on, it would work a little bit better. Now, dorsiflexion, that's where you pull your toe up. That's an important one. If you're by yourself, you pretty much have to wrap it around something, the leg of a chair or a table like this. You don't have to get me on it, just get my foot, okay? They don't want to see me. And then you work this. And this is an important one, isn't
Yeah,
it, Bob?
it is.
And then,
Yeah.
of course, plantar flexion.
That's easy enough. You can just take it and push. Yeah, like
Yep.
that.
Now, or, if you have another one, you can just pull it around
Right.
and hold it. Or, eventually we're going to try to do plantar flexion and weight bearing. Are you getting to that, Bob? I don't want to. Jump
Yeah,
ahead.
because you could go up onto your toes. Right. Yeah,
Right.
go ahead, show that. Yeah.
Sure. So you're going here. And the nice thing about this is you got one strong ankle and one weak. I would not do it with a shoe on and a shoe off, but I don't want to take the time to put my shoe on from that ankle brace. But if this one's a sore one, I'm going to do a lot with this one, then I'm going to slowly add. And if there's no pain and it feels good, I'm going to slowly shift my weight from my left to the injured one. And then I'm going to go 50-50. As it gets stronger, I'll go just on one foot. And that's how you progress with plantar flexion.
Wonderful.
Working these muscles.
All right. Then the one thing that really is key that you do make sure you work on is proprioception.
Sure.
You want to have the ability for the ankle to know where it is in space without looking at it.
Right.
So a test for that is a lot of times so if this is my involved ankle, we have you stand on one leg and they're often usually all over the place then
Right.
compared to the other one because they've lost that ability.
Right.
So,
You got to tune in the nervous system is what you're doing.
yeah, you got to
essentially.
retrain it.
Yep.
And we were just, by the way, given this board, Brad, by Gabo. It's a Gabo board.
Gabo.
Very good board.
Yeah.
I'm really impressed with this, Brad, because what it is, it's a progression. You have the ring here, and you can fill it up. Now, I got it filled up all the way right now,
Yep.
and because of that, it's very stable. You put this on here. And the other thing I like about this, Brad, you can do this on a slippery floor. You don't need a pad.
Oh, sure.
You know what I mean?
Yep.
It stays in place, where the other wobble boards, This is a type of wobble board.
Yep.
They'll slide all over. You got to make sure you have like some stickum or something.
Right, some shelf liner or some dice or
Right.
something rubbery so it doesn't slide around.
Now, with this, you can certainly start just by sitting, Brad, and going forward
There you go.
and back. And it's just even a little bit of strengthening with the gobble board.
Yep.
And then back and forth this way. And then you can go in circles.
Yep.
One way and then circle the other way.
This, when you got an ankle sprain, this can be challenging at
Yeah.
first. Looks easy here, but when you're sore, it's.
But this is one of the more stable wobble boards I've seen, Brad, when it's when it's filled all the way up with air. And you'd want to start off with probably hanging onto a chair or a cane, because you want to make sure you're not going to fall off or you're not going to hurt your ankle.
Right.
But I can go back and forth. I can go back and forth this way. I can do my circles on this and circles the other way. And then eventually I can work to 1 foot.
Right.
Going with one leg like this.
Yep.
And eventually, if I want to make it even harder, Brad, I can take some of the air out of the cushion.
Sure, and it gets a little more wobbly.
It gets a little more wobbly. Yeah, this is $29, $29.95. I know that's a good price for a wobble board.
It is.
So,
And I got to be honest with you, Bob. I really like it. I tried it before, and it's so smooth. That's
Yeah.
the nice thing about it. It doesn't slip, and it's got good grippy on there. It's built well.
yeah.
A+ on
Yeah,
that
congratulations on a good product.
one. Yep.
The last thing, Brad, is I started having people, even the elders, I have them do this. I have them start walking forward. I have them walk backwards. I have them do sidestepping.
Yeah, that's a big one. I like that side step.
And then I have them do, is it karaoke? Or karaoke,
Oh yeah,
like this.
grapevine, karaoke,
Grapevine.
whatever you want to call
And
it.
if you're an athlete, then you're going to do these at high speed, of course.
Right. Yep.
And you're going to go.
Oh, yeah. Well,
All right.
that'd be
That's
a whole
the-
nother video for,
All right.
for those things. So
That's the 7, folks. So good luck and thanks for watching.
7's a complete number, Bob.
Yeah, it is.